Whereas in healthcare, hospital decides. You come and stand in the queue. The most of the care is delivered based on provider's convenience. So it is not very close to the patient, not only by distance, but also in understanding. We have a big rural and urban divide in delivering healthcare. In India, very small percentage of the people have got insurance. Government of India recently, about 3-4 years before, they've created something called Ayushman Bharat, where poor people in the country, they get an insurance from the government. We have to be very careful. Just keep on giving insurance is not going to help us. Whether it is diagnosis, during consultation, post-consultation, continuous, connected care is possible in healthcare only because of AI. That is the reason AI is going to make a big stride in healthcare. Countries like India, AI is a boon, especially in healthcare. As I told you that we have one doctor for every 1800 people. So I've been asked to speak to all of you about AI in healthcare or overall about healthcare. See, what I will do is about 5-10 minutes. I'll just give you an introduction to healthcare. I don't see most of us know healthcare because whenever we feel unwell, we try to go to an hospital or a doctor to get treated. So in a simple thing, that is healthcare. So that means healthcare is a sector, imaginably that should be the one of the oldest sector. And right from any point of time, human used to become unwell and somebody has to treat them. So now, how do the healthcare happen in India and worldwide? Do you have any idea? If anybody wants to say how healthcare as a sector, how the healthcare has been delivered to people? Do we know some idea? So you are saying some clinics and hospitals then?
Pharma techs that exist worldwide, delivering high-tech, cutting-edge quality healthcare to the individuals. So all of that comprises healthcare.
Okay. So what's your name?
So it's Astha.
Shasta. So Shasta says there are a hospital and clinic and then some pharmacies, and through that we deliver healthcare. And she's also used the word cutting edge. See, I'll quickly take about 5 minutes to explain, or 5 to 10 minutes to tell you a few things. The worldwide, when we really think about when you feel unwell or not feeling good, we have to go to a doctor. And we see a doctor either in a clinic or in a hospital. And then the doctor performs certain tests, either through an equipment or through a laboratory or himself, and comes up with a prognosis and diagnosis, and then decide a treatment to be treated. And then mostly the treatment is either you give a medicine or some therapy, and that's the way people are treated worldwide. And it has been the format on which healthcare is being delivered worldwide. But in this, let's look at what is the technology use, how technology will be used, or technology is being used. Will it be technology has any useful purpose here? For example, if you think, say the doctor has studied medicine by studying an MBBS or a degree, and then they do a specialization which we call as MD, and then they work in hospitals, treat several patients, or work in various places, they have experience. So when somebody goes to a doctor and presents themselves with certain symptoms, okay, I have cold, I have headache, I have stomach ache, and I have a leg pain, something like this, we present with a symptom. The doctor is already trained that if you present with these evidences, and this is the treatment I'm going to give it to you. That's what is being taught, and that is what he's got the experience. And so patient is saying, I'm not doing well and this is my problem. Doctor does a test or testing him or do some evaluation, and then he's going to give him a medicine or he's going to give him some therapy. What is the use of a technology there? What is the use of a computer there? There is no need for a computer for a doctor to use. So this is one side, you keep it in your mind. Then we'll come to the other side. So if you look at the way we treat patient worldwide, it is you fall sick, you go to a doctor. If you have a late cold and headache, sometimes you'll go to a local pharmacy and ask the pharmacist to give you some medicine and you'll feel well next day. If you have some fever and a little bit of some other discomfort, you will go to a clinic. And if it is little more serious or you feel you're not able to do something, then you'll go to an hospital. When you go to an hospital, there will be a department called outpatient department or called OPD. Then some doctor will treat you. If you are very seriously ill and then you need a surgery or some other procedure to be done, then you might get admitted in the hospital. Then they'll put you in a ward, which is a room in an hospital, and then they treat you. But if you watch all of this, it is all one event to another event which is not connected. It is, we call as episodic. Worldwide, whether it is US, France, Germany, Japan, Singapore, Australia, India, anywhere, the treatment is done episodic. One episode to another episode. Then the second thing, you go to a pharmacy and collect a medicine and you eat on your own. Or you go to a clinic, doctor gives a prescription, you go to a pharmacy, collect that medicine and eat it. And it is highly disconnected. Nothing is connected. Then, what is the treatment to be given? There is a protocol. There is a guidelines. They call us care pathways. This is the way to treat. If you say this symptom, this is the way to treat him like this. There are some procedure given. Now, most of the thing, I just want to ask you a question. See, when you go to a doctor, you pay for it. Correct? Whereas when somebody gets admitted in the hospital, sometimes you would have seen they will have an insurance and the insurance pay for it. Have you heard about it? Insurance paying it, right? So, in some countries, private insurance, they pay for your care and you pay insurance every year premium to them. In some countries, government gives the insurance. Government says, okay, if you fall sick, you come to our hospital, we'll treat you. So either a government or a private insurance company, generally they consider to pay for your treatment. If they pay for it, they are called payers. The hospitals and the doctors and clinics and all is called providers. They provide care. Insurance companies, they pay for the care. So there are three stakeholders in healthcare. One is a patient, another is a provider, another is a payer. There are three P's: patient, providers, and payers. But over a period, what happened? The insurance companies, on what basis they pay you? What is your sickness? Who has treated you? Whether he has treated you correctly? And for your treatment, they'll pay. It is not that whatever you are asked, they are going to pay. Or whatever doctor is going to give the treatment, they are going to pay. They have certain rules. That rules generally defined by the insurance companies. But that rules over a period, it become stricter and stricter. Then insurance companies started telling that how to treat a patient. So worldwide, when you look at it now, the treatment given to you, the guidelines or at least the overall model on which how to treat you is called payer-driven model. Payer says how to treat you. The insurance company tells the doctor how to treat the patient based on your sickness. Most of the time. Then these doctors and hospitals, Have you gone, when you go to an hospital, like when you go to a five-star hotel or when you go to a consumer retail store, where your convenience and your preference is very important for as a customer service. You are all studying in you are doing a business conclave, customer service, treating the customer and understanding the customer becomes important in a lot of sectors. Whereas in healthcare, hospital decides. You come and stand in the queue, you do the registration, you go to this department, you find the doctor. Most of the struggle you will be doing and limited help you get how to get to a doctor, which doctor to treat. Right? So this has been the normal part of it. So the provider, the most of the care is delivered based on provider's convenience. So what I told, payer driven, provider convenience. Then most of the care is not very close to the patient. They don't know you, they don't know your family, what situation you are in, because you are going very transaction. You go to a doctor and come. So it is not very close to the patient, not only by distance, but also in understanding. And it is not centered around the patient. So if you remember whatever I told you in an order, the care in healthcare today, which is episodic in nature, one episode to another episode. Second, it is disjointed. Third, it is payer driven. Fourth, it is provider's convenience, little far from the patient, or it is not close to the patient, and it is not patient-centric. These are all the challenges of healthcare worldwide. And India has one more extra problem. In India, about 60-70% of our population lives in the rural India, in villages, which is far from the city. Most of our healthcare delivery hospitals are there in big cities. So the disease burden is very high in rural India, but the care is in urban India. And we have a lot of people cannot afford to come to a city and take the care. Not only afford, and they cannot do it in an easy manner. So this is our big problem. Then most of our healthcare is centered around, we call as a tertiary hospital. Healthcare is divided into three types of delivery. One is primary care, which is whenever you are feeling cold, cough, you go to a doctor. A primary care physician, generally they call as a doctor called general physician or a family physician. They check your thing and give you, they can treat any sickness, but they are not specialists on anything. So predominantly a general physician, the primary care happens with the general physician. Then there's a secondary care where you have some dental issues, you have some eye issues, some procedure has to be done, one small surgery has to be done on your nose. All of these are secondary care. You will see some nursing homes, small hospitals. There are secondary care hospitals. The third one is a tertiary care, which is specialized. Cancer, heart problem, heart surgery, heart procedure, gastroenterology surgeries, procedures to be done, those tests to be done. It's called tertiary care. Then there is one more in the recent time called super specialization. Some people will do on a specific super speciality hospital. They'll specialize on neuro, cancer, heart, like that. So this is the way the healthcare is delivered. Now, in India, it is considered that in rural India predominantly, throughout India, the primary care and to some extent of secondary care, government provides close to free of cost to everybody. You can go to any government hospital in a village and you can get treated close to free of cost. And tertiary care and super specialization is generally, after 1980s, it is done through private hospitals. And you can see Max Hospital and various big hospitals in Delhi. All of these hospitals are private hospitals. They focus on specialization, multi-speciality and tertiary care. This is the way the healthcare is delivered in India. In this, what is happening is, because most of the people live in rural India and most of Indian health institutions are in urban India, and also the senior doctors or all of them, they cannot live in the rural India because their children requires good education. But education institutions are there in the cities. So how a doctor can live in a rural India but his children can be in the city? So this way what happens? We have a big rural and urban divide in delivering healthcare. These are all the challenges. Now, if all of you are following with me this, I'll go to one more topic which I'll tell you, then I'll start taking and discussing with you. So there is another one is, if you look at traditionally technology used in, I told when a patient is in front of a doctor, doctor knows how to treat it. What is the use of a computer? So because of this reason, what happened? If you look at from 1950s, when there is a big semiconductor revolution happened, then we had huge manufacturing explosion, industrial growth happened. Then we had internet growth happen. Like this, in every stage, there's a big change happened in the technology side. And if you look at it, which sector adopts technology very fast? Financial services and banking adopts very fast. Then comes to retail, then comes to manufacturing like this. Then comes to public sector. Government adopts technology last. But healthcare, just before government, they adopt technology. If you really look at why healthcare is not adopting technology whenever the great technology evolution happened, we look very closely, there are two reasons. Reason number one, most of the time the technology improvement happen assumes when a patient is with a doctor, which is like when you do surgeries, when you do procedure room and all, nice big equipment, very intelligent equipment has been developed that is used. Like nowadays we are talking about robotic surgery and all, no? So most of the time on an equipment space or a diagnosis space, somebody is manufacturing good technology equipment, people uses it. Most of the innovation is done when a patient is with a doctor. Whereas, in all of the, but our problem is to get to a right doctor. So now, in all of these years, whenever the technology advancement happened, healthcare never took the technology very seriously. But now slowly I'm coming to the explosion of AI. Now everywhere artificial intelligence is being spoken. And we are having when we are doing this talk, we are having a AI Impact Summit in Delhi. Now this AI Impact Summit or whatever we are talking about AI, how it will impact healthcare. What I feel for the first time, AI presents a very intuitive situation between a doctor and a patient and overall healthcare. So healthcare for the first time has an opportunity to become the forerunner in leveraging technology for the benefit of patient and provider and payer. So AI is going to really revolutionize healthcare. So this is an introductory topic I just wanted to share with you, and some of it was relatable to you, but I tried to do as much as possible from my side. Now what we can do is we can quickly switch over to interaction. You can ask me any questions or you can make your comment, and if you want to know specifically in any specific area, we can do it. Before that, I'll just summarize it. In India, we have a huge problem of delivering healthcare. Poor people, rural India people doesn't have access to healthcare. Even if you there is not availability of doctor, availability of hospital in rural India is very difficult. Both in the public, whether it is government providing services or private providing services. Second, the availability of the right care. Even if you go to a doctor which is there in rural India, the doctor need to know how to treat you. So that is a challenge, the availability of the right quality care. Third is we have a huge challenge of affordability. Access is there, availability is there, then whether they can afford to pay for it. So rural India, poor people, it's becoming a huge challenge. Even for a people who can afford, the availability and access is a challenge in the rural India. In urban India, the access is reasonable, but still availability of the right care is a challenge, and affordability is a huge challenge everywhere. Because in India, very small percentage of the people have got insurance. Now, Government of India recently, about 3-4 years before, they've created something called Ayushman Bharat. Is there about for 5 years now, where poor people in the country, they get an insurance from the government. They can go to a private hospital to get treated. Then government will pay for it. That is called Ayushman Bharat. It covers about 40-50 crores people in the country. And very small percentage of the people who do the insurance, rest of the people have to pay out of their pocket whenever they fall sick. If you assume a poor man in a farmer or somebody in the village who falls sick, a terminal illness which costs a lot of money, 27% of Indians become indebted for rest of their life if there is any big healthcare episode happens in the family. If a father or a son or a mother or a daughter, somebody gets a very serious sickness and who does not have insurance, which most of it don't have, so they sell their land or they take a loan and pay for their hospital expenses, the debt remains throughout their life. So that is the situation of our healthcare. And this is since you're all young and doing your undergrad, I thought to give an introduction that how the healthcare in India is delivered and what are the challenges we are facing. And I believe we have a big hope technology and AI can solve this divide. With that, I will stop and over to all of you for any questions or interaction.
So, sir, my question कि government percent on healthcare expenditure. Sir, on healthcare, as all the developed nation is spending around increase or significant expenditure on healthcare, and think the government should provide the insurance to everyone, as not everyone in India can afford the insurance.
So Garima's question is a pertinent question. So, see, spending is one. It is not about the spend. It is about the utilization. For example, we have about one doctor for about every 1800 people in India, which is true in urban India. But if you go a little far away, this average goes very high. And if you take a mental health for that matter, we might have one doctor for every 5 lakh people. It is impossible to treat with one doctor with 5 lakh people. So, this is point number one. So, you cannot just increase the access by spending more money. Now, the second part is we need to increase the number of doctors. So, the number of doctors, I think India, we produce about 108,000 new doctor every year who comes out of our MBBS degree. Now, are we putting them into use correctly? Are they able to become functionally a doctor who can treat patients? And most of our doctors are expected to do an MD, a post-graduation in medicine, post their MBBS. That takes very long time. After getting their MD, they have to work for a few hours by the time they are productive. So that means, Garima, what we are seeing is, if you spend money today, it will take 15 years, 10 to 12 years by the time you create that capacity minimum. So that is not the way to solve the problem by just throwing at the money. So you need to look at, certainly we need to increase, but we need to know how smartly we solve this problem. How do we make our health system efficient? How do we, today one doctor in a OPD setting can see about 700, 800 patients in a month. We need to see that, okay, first we need to understand, okay, how do we increase that to 5,000? Whether technology can help it. Once we have clarity, then you will automatically decide, once you are able to understand what is going to be the impact, what is going to be the outcome, then you can bring this into a model of applying the funds from the government. This is point number 1. Point number 2, you are asking whether government has to give the insurance for everyone. The answer from my side, I don't know, but I can give you some indication. Some of the developed nations, they provide healthcare through their government insurance to everyone. How they're able to solve the problem? They're not able to solve the problem. Same problem remains. So, by just increasing the GDP ratio to spend more money on healthcare is not going to solve the problem till you know how we are going to apply these funds. That's the first question's answer. Second question, if you take various other countries in the world as an example which provided insurance from the government or providing care from the government, still their healthcare problems are same. The only thing what they have done is they have increased the cost of delivery. For example, if an average cost of serving a patient in India is about 500, 600 rupees, it is about 5 times or 10 times in other countries in dollar terms. So, the answer to a question is we have to be very careful. Just keep on giving insurance is not going to help us. We have to first get the care delivery right. Once we know what is the delivery model and if we can cover the whole population, then we can calculate how much is the private insurance, how much is the government insurance, and also need to understand in India, healthcare is a state subject. Central government participates, but healthcare is delivered through the state government. So there's a lot of policy making and the regulatory changes which happens on the ground level. By just changing at a central level, saying that, okay, I'm going to give insurance for everyone and I'm going to provide care, we cannot solve the problem. It's a very complex problem. It requires thinking. Anybody else? Next question.
We also lack a lot of medical infrastructure in rural India. Also, the lack of manforce in the whole medical diaspora. And you were also talking about AI in healthcare sector. If AI was to be implemented in the next 5 years, let's see, what particular sector or is the particular diaspora or the level of healthcare related with Treasury, Super-Speciality to cater the immediate public needs should be implemented in the next 5 years? An application of it.
Okay. What's your name?
My name is Pallab, sir.
Okay. So Pallav is asking, okay, how do we implement AI in healthcare? So it's a overloaded question. I will respond. So anybody else has a similar question so that I can take all the questions and answer in one shot. AI in healthcare, that's a question from Pallav. Yeah, here one, there one, yeah, go ahead.
Sir, I had question. Basically, recently the insurance trend is rising and also the profitability of company which are providing healthcare services is also rising. And recently, lot of IPOs are coming in healthcare sector. What could be the possible impact on profitability of healthcare sector for next decade? Thank you, sir.
Okay, so that's a totally different question. So she has a question. So let's stay for next 2-3 minutes. Any questions on AI in healthcare? Then I'll come to profitability and all after that. Okay. What is your name, sir? Madhav, I will address your question later. First, I'll take the AI questions.
So firstly, thank you so much for such an insightful session. I believe you mentioned the triad of a payer and the patient as well as the insurance provider, right? So that is something that brings me to ask, some companies like Practo are already adopting AI in this triad by incorporating AI and cutting edge technology that we had mentioned earlier. My question to you is, since you already mentioned the rural-urban divide, and there's a rising public scrutiny when it comes to any adoption of any such technology, which also contributes to why healthcare is one of the last sectors to adopt any kind of technology. Do you believe, to what extent do you believe, the AI adoption would be taken by the public due to rising public scrutiny in terms of the same?
Okay. So basically, I'll summarize your question. What is the AI adoption going to be? Right? Anybody else on AI in healthcare?
Sir, I want to ask whether the AI and health sector will be complementary, or will it have the complete automation with negligible human interaction, or it will remain at status quo? That's my question is.
Very good. What is your name?
Arpit.
Okay. Very good question, Arpit. So, as I told a brief about AI before while introducing, so I am personally confident that because of the capabilities of AI today, and it is evolving very fast, and it is expected to grow very, very fast in a most impactful way. For the first time, healthcare has a big opportunity to adopt technology for clinical outcome and patient convenience, and overall make a big impact on healthcare. So AI has a capability to make it happen. Any technology which came in the last 70 years has never been so compelling and so important for healthcare to adopt. So to answer our question, AI is going to create a huge impact and very high adoption in healthcare. Then the next question is, Pallav's question is, how AI will be adopted and impact, what is the impact it would create? So, let us look at various stages of healthcare activities. The way I would see, mostly it is centered around all this time, a reactive care. Whenever you fall sick, you go to a doctor and doctor writes a prescription, you come back home. If you have any questions or if you have any other discomfort, again you go to the doctor, take his appointment and make it. Whereas what healthcare is required is continuous and connected and proactive care. For example, if somebody is diabetic, or somebody is obese, or somebody has got hypertension, BP, and these kind of diseases requires a continuous interaction with the health system. And we have over a period, last 30-40 years, we have evolved only doctor can solve this. But what is going to happen or what is happening is, most of it, an intelligent AI with the proper accuracy can solve this interaction between patient and a doctor very easily. And whenever on a specific situation, a human in the loop doctor is required to correct it, he can come in an organized manner. So this is a big revolution which AI can bring into healthcare. Second, I told you earlier, when a patient is presenting with evidence and problem, and doctors know what to treat, what is the use of a technology? But nowadays, when you go to the hospitals or see anything, doctor won't look at you at all, he'll be keep typing in the computer. And because he's more interested in putting your data in the computer. Whereas, AI gives you a major opportunity through an ambient listening that doctor can treat the patient, but AI will document everything for you. Now, not only it can document, the agentic AI can do lot of operational activity. Prescription preparation, sending the notification to pharmacy, medicine get delivered automatically. Right? All of this is possible. So, combination of operational agentic AI and deep clinical intelligence can be developed using AI to treat a lot of situations. Then the diagnosis can become more and more effective and accurate because of AI. The kind of ability we have in processing images and ability to remember various things which has happened. Now, for all of this, the digitization and the digital aspect of data is very critical. Unfortunately, that has been a little weaker in India, but it is evolving better. So, to summarize Pallava's question, in various stages, whether it is diagnosis, during consultation, post-consultation, continuous, connected care is possible in healthcare only because of AI. That is the reason AI is going to make a big stride in healthcare. 5 years from now, 10 years from now, the healthcare is going to be very different because of AI. Now, coming to Ankit's question about whether AI is going to increase job, reduce job, more people are going to get, what is going to happen? See, AI per se in healthcare, countries like India, AI is a boon, especially in healthcare. As I told you that we have one doctor for every 1800 people. See, in cancer, if you look at it, the oncologist, cancer doctor is called oncologist. Then oncologist and oncologic surgeon, when we did a study, 52% of the time they are spending in non-clinical activity. About 35% of the time they are doing administrative activity. A surgeon needs to do more surgery rather than doing paperwork or doing coordination. So, all of this can be done by technology along with people. So, what AI presents to healthcare, it will free up a lot of doctors' time and make doctors to focus on clinical activity. Doctors, technicians and medical professionals, they will focus on their specialization. Lot of BSc graduate, paramedics and all of it using AI, they will be doing what doctors were doing. It's a wonderful solution. Doctors have become efficient. We were treating 1,000 patients, now we can treat, the same doctor can treat 5,000 patients. But at the same time, a lot of people who needs job, who is non-doctors, can play a role in healthcare sector by using AI. So, to answer your question, Ankit, it can increase job, at the same time solve the healthcare problem, will make it very efficient. So, I think I've answered most of the AI questions. Now, I'll come to the capital market driven question about profitability in healthcare. I will paint a picture very differently about healthcare and profitability. See, obviously that Indian health sectors and worldwide, private healthcare, which is the main motive of making profit as one of the main metrics, plays a very important role in healthcare. So, there are a lot of private equity firms and investors have been investing in Indian healthcare, and that is a huge growth is happening. I feel with the right profitability in mind, not taking away from the quality of care or the accountability of care, private enterprise can make profit and there is a huge growth is possible. So, with that, what I will do is I will quickly play a video for all of you so that you can understand what is the impact of AI in healthcare. So, this video is going to show you what is the possibility of healthcare in today's technology available. Nothing future. With the available technology today, how healthcare can transform Indian healthcare. You please see it. Thank you. Thank you, all of you.
In a city that moves fast, health doesn't always keep pace. Across India's metropolises, millions navigate long days, constant demands, crowded spaces, and unexpected triggers, leaving
All
little time
lessees,
to
please help
recognize when
everyone
something is wrong
to
and
be
even
seated.
less time to act on it. Factors in urban India such as unhealthy diet, sedentary life, higher stress levels, and rising pollution are contributing to a growing burden of chronic diseases such as diabetes, hypertension, obesity, and allergy, amongst others. India's chronic disease burden cannot be managed effectively with the prevailing healthcare system that focuses on episodic, disjointed, reactive care that is often provider-centric and far from the patient. Based on clinical insights gained by implementing several healthcare initiatives for over a decade, the Tata Group has designed a model to provide proactive, continuous, connected, patient-centric, and closer to patient care that enables effective management of chronic conditions. A new guardian, Tata DINC.AI. DINC.AI links patients, clinicians, care providers, diagnostics, imaging, and real-time insights, creating a smooth, continuous chain of care that adapts to each person, just as it does for Seema. Meet Seema, a 45-year-old businesswoman whose work moves her across cities, airports, hotel rooms, and boardrooms, a schedule that rarely pauses. For the past 2 years, Seema has been living with chronic allergic rhinitis and intermittent asthma, conditions that react to food, dust, air quality, and climate shifts. For someone always on the move, managing these triggers isn't simple. Pollen, dust, humidity shifts, lactose, gluten, and pet hair can trigger breathlessness or a flare, making travel to a different location even more challenging. But today, DINC.AI accompanies Seema wherever she goes, working quietly in the background, anticipating risks, reading patterns, and guiding her through every step. Ahead of a major stakeholder summit in Mumbai, Seema sends a simple voice instruction to her team. DINC.AI captures it instantly, blocking calendars, syncing schedules, and building a travel plan around her. But this time, DINC.AI detects more in the background. Using patterns from Seema's earlier Mumbai trips and predictions for pollen, air quality, humidity, and temperature shifts, the system flags the journey as high allergy risk. Through its integrations with Air India, DINC.AI sends a medical-aware travel request. It recommends avoiding early morning or late night flights and books an optimized option instantly. At the same time, her preferred hotel receives her allergy profile, ensuring her room is thoroughly cleaned, is set up with feather-free bedding, and has zero pet exposure. The night before travel, DINC.AI analyzes her wearable data. It detects restless sleep, elevated heart rate, breathing changes, and a drop in peak flow compared to her 30-day baseline. It alerts her to pack for Mumbai's humidity shift. Take Montelukast with levocetirizine. Take 1 preventive puff of Asthalin and carry safe snacks. Basis Seema's care planogram, DINC.AI also reminds her of a flu vaccination that is due, knowing viral infections can trigger asthma, and suggests scheduling it after she returns. At the airport lounge, when she's unsure what food is safe to eat, the DINC.AI food scanner identifies allergens instantly, personalized to her sensitivities. When cabin temperature causes sneezing, DINC.AI registers the changes in Seema's vital parameters through her smart wearable and reassures her that her controller medication is active. As soon as she reaches Mumbai, the weather triggers irritation, altering her breathing pattern. Through her wearable, DINC.AI registers the altered breathing and suggests an immediate pulmonology consult. In the cab, Seema speaks to a specialist virtually who already has her clinical data, peak flow trend, sleep quality, and respiratory patterns. It's a weather-triggered flare, but DINC.AI caught it early. The specialist adjusts her medication and arranges for a nebulizer to reach her hotel within the hour. When Seema reaches the hotel, She finds a room already prepared with zero pet exposure, exactly as DINC.AI instructed earlier. A nebulizer has been delivered too. She nebulizes, feels steadier, and gets ready for the summit, all supported by DINC.AI's timely and intelligent intervention. Seema successfully attends the stakeholder summit without any allergic flare-ups. She books a cab back to the hotel. The route passes Gateway of India, an area with high pigeon activity. Using its integrated intelligence, DINC.AI flags the risk and recommends an alternate path, helping her avoid the trigger completely. Throughout her trip, whether in transit or between meetings, DINC.AI acted as a constant health companion, quietly assessing air quality, allergens, food risks, environmental triggers, wearable vitals, peak flow patterns, and medication adherence, so that Seema could move through her day without disruption. Seema completes her trip without any emergency. Her summit succeeds. And for the first time, her health doesn't interrupt her life. It moves with her. DINC.AI has been developed using insights drawn from tens of thousands of primary and chronic care cases, reflecting the clinical thinking observed across patients' long-term health journeys spanning 2 to 10 years. It synthesizes the decision-making approaches of over 100 clinicians and is grounded in both national and global medical guidelines. This collective clinical intelligence powers DINC.AI's master care planogram engine, enabling the creation of individualized treatment plans for each patient, as it did for Seema. Patient-centric holistic care shaped by continuity, connected by intelligence, and delivered proactively closer to the patient. This is DINC.AI.